had a client who called us and said, look, I don't use a lot of healthcare. I do more naturopathic stuff outside of it. I know I need to have something in case of the big what if, that 20% with Medicare by itself that isn't covered. But outside of that, I'm really looking at ways to lower my overall cost outside of healthcare. So what is available on the Advantage side? And it really got us thinking about this whole strategy of, I don't use a whole lot. Are there ways I can take advantage of that model to save money or have other different options on the outside that actually bring value to people? And we created a whole grid specifically for this client, but we can do this for you as well if you let us know a little bit about your situation. So let's go into ways we can save if we're healthy with an Advantage plan if we're on Medicare. Let's go into that now. Before we jump into these strategies, remember, we still want a good core Advantage plan, meaning it needs to be 4+ star ratings generally, because anything below that kind of indicates that the existing members are not happy with how it functions. Granted, you may not be using a lot of healthcare now, but things come up, especially lately, right? There's a lot of weird stories out there for kind of big ticket items. I've personally seen it myself. So it needs to be a good plan. It needs to have high star ratings. It needs to have networks that we actually want to go to, whether it's Sutter up north, UCLA down south. We need to dial that in first. So let us know any doctors, hospitals you want access to, and then we will filter out the plans that don't have good star ratings, look at the others. Then from there, what are the strategies we were talking about? Well, let's look at the two big ones right now. They are give back plans, Part B give back, and then there are flex cards or over-the-counter kind of added benefits. Of course, there's always the vision and the dental. Dental can be a big one depending on your needs. And of course, other options from there, from fitness, you name it. But the two big ones are the give back, because that's real money, and then the over-the-counter or the flex cards, that's also real money. And let's look at those in a little more detail. We have whole videos on the Part B give back because it's becoming more and more popular. But essentially, what it does is if you have a plan with a Part B give back, it will pay up to a certain amount towards your Part B premium. That's the amount that usually is deducted from Social Security. So that, even though you're not getting cash, you are reducing the amount you have to pay for your Part B up to a certain amount. Then that's the same thing as real money because you're going to get more Social Security. And it can be a lot. So if we're in LA County, it could be up to $150 a month. That's $1,800 a year in real money in your pocket because your Part B is getting reduced. Again, we have entire videos and lots of articles on how the Part B give back works, but it's very popular for people who just don't have a whole lot of health care. And if I can save almost $2,000 towards my Part B, that's money in my pocket. That's very important to a lot of people, more important than some of the other options that are out there. That's one piece. The other piece is over-the-counter or flex card options. These are options that usually allow you a certain amount either per month or per quarter that you can pay for over-the-counter things out of drugstores. And when you go through drugstores now, you'll notice there are all these things. Oh, this product is eligible for Advantage Part B or payouts. So now you can start to get things for free or towards this allotment you get monthly. Some even have flex cards that can be used for utilities, for all kind of fruit, for food items, you name it. So that's another kind of piece we want to look at. How do we compare these two? Personally, we like the Part B give back, and here's why. Have you noticed over the last 10 plus years, every company out there wants to do gift cards. They want to give you a $50 gift card, $100 gift card, rather than give you $100 in cash. There's a reason for this. Most people either lose the gift cards, they don't spend it all the way down, so there may be $5, $10 hanging on these cards they can't really use. Well, you add that up by 1 million people, it's a lot of money. The companies love that. They're hoping you either lose it, it eventually times out, or you just don't use it fully because it's like $5 left. Well, to them, that's a a 5% extra margin on that $100 card. They love this. So that's kind of the theory with the over the counter. Some of them will roll over, but some of them are use them or lose them. Meaning, if you have $75 a month of over the counter benefits and you don't use it within that month, it's gone. Believe it or not, it might be hard to spend $75 in a local drugstore on things. You may not need it for months at a time. And even on the more flexible flex cards where you can use it for other things, that can be tricky too. Or if you forget to use it, it's just gone. Whereas the give back plan, that Part B premium is coming out of your Social Security every month, like clockwork. They don't miss their payments, do they? Unlike some of us, they're dedicated on that. So when you have a reduction in that Part B premium, it means you're getting more cash. Your Social Security check is going to be bigger by that amount. So in that example in LA County where we had $150 a month, that's $1,800 a year you're getting. Whether you forget to do something or don't need it, $1,800 is in your pocket. Versus the over-the-counter or the flex cards, boy, you got to be diligent about using that and clocking before the deadline. And if you don't, it goes away. It just turns out that most people aren't that dedicated, and so they lose some of those benefits. So given the two, we're going to opt for the Part B premium if the plan is also solid, meaning the 4+ star rating. If the networks are good, we like the doctors and hospitals we have access to. If our health is pretty good to where we don't have a whole lot going on, because that max out of pocket may be bigger to compensate for the fact that they're giving you cash up front. And we can help you calculate all this. But in that situation, we really like the Part B give back much better. Fitness, vision, dental, especially the dental, because when we're over 65, there tends to be more dental work needed. Yes, that becomes important. We have to look at that. There are add-on dental benefits we can add to a core kind of benefit. And usually carriers sometimes have their own add-on, like extra dental, or we can get Delta Dental or even VSP for vision. But the dental is usually kind of a commodity. It's going to be pretty comparable. That give back plan is unique because that's real money that goes towards things we actually spend on if we're in pretty good health. So that is usually our driver. It depends on your area, what's available too. We need to run quotes to see what's available in your area. If there is a give back, if it still is well regarded, what the other over the counter or flex card benefits are. We look at all of that for you. We just need date of birth, zip code, and then doctors, hospitals you want access to. That's important. And medications and dosages. You can email that over to us. Let us run the quote. The rates are identical through us as through the carrier, through any other agent. But we'll really go through and let us know that that is your idea, that you're in good health. You want to see what other options on the Advantage market might save you real money. And we'll get to work on that right away for you.